So welcome. I'm pleased to introduce our corporate sponsors, Ziegler, and Dan Herman and Lisa McCracken, who will be speaking today. And with them is Tom Myers, who has been with Ziegler for 25 years. And we're delighted. This is the 7th year that we have had the partnership with Ziegler, and we really appreciate you being here. Today's session is Diversity and Governance, Today's Leadership Imperative. And while this topic will have a strong emphasis on senior living focus, I think it's something that will apply to everyone as we go into the governance realm and we talk about the post-pandemic macro environmental factors that we all face regardless of what type of ministry we're working in. So with that, I'd like to introduce Dan Herman.
And I do need that clicker. Super. Thanks a lot, Mike. It is going to be hard to be as energetic as those last speakers. We don't have all the tools in the toolkit. We're just finance people. Bueller. But we really want to make this meaningful to you all. It's been a wonderful partnership between Ziegler and CHHSM over the last number of years. We believe approximately 7, where we've been in this sponsoring position. And we have a number of wonderful senior living clients on that side of the business of all the services you all provide. Many are in the room and many were in yesterday's room. So we really do appreciate the relationship, appreciate the work you're doing around the country from market rate senior living to affordable to home and community-based services in today's very competitive and challenging senior living and service markets, social service markets. But you do have wonderful opportunity with today's demographics that we'll touch on later today. We do just want to give you a quick, and I'll make this quick overview of Ziegler because it is fun and ties into your history. So we, and is Mike still in the room? We're at 120 years at Ziegler from, I'm going to call on Nicole real quick, from West Bend, Wisconsin. Going all the way back to the Ziegler family, 120 years, 1902, and our organization grew up providing financing, capital to finance buildings for not-for-profit institutions all over the Midwest and then America. So it's a great story that the Ziegler family built up, and now we're a privately owned investment bank. Today, as you can see, they're providing investment banking services. Half of that is capital markets related, meaning raising capital to build communities, and half of that is merger and acquisition services. And then, many of you know we have our proprietary investment arm. We're coming up on our 18th specialty venture and private equity fund after the Ziegler linkage funds, which we'll talk about a bit later, Ziegler Linkage Fund 1, 2, and 3. And Linkage is a consortium of 14 not-for-profits in Ohio. That's a JV partnership. Many of you partner all the time. United Church Homes, for example, is a member of or an owner of Linkage, and they're in the room here. But we're actually, speaking of impact and DEI initiatives and so forth, launching this week our Ziegler Healthcare Innovation and Impact Fund geared to health systems like Advocate, who we hope to be an investor in that. That'll be very specific to health systems. So we're having a lot of fun at Ziegler around this focused area of investment banking, capital markets, and proprietary investments with 21 offices around the country. Tom and I are in Chicago, and Lisa works out of her home in New Jersey and Pennsylvania. And we have we're now 190 professionals. So we just point out this little chart showing that the sectors we're in that do touch CHHSM members in senior living, healthcare, and then also education. I should note, and we finance private schools around the country, in particular colleges that are 3,000 students and down generally in what we'd call the credit-driven capital area. And we've now financed dozens and dozens of charter schools, some in the neighborhoods like we heard about earlier, and that's a big movement in the country. And I always like to remind this group that I actually grew up in St. Louis, literally within a block or two of the Eden Theological Seminary, and one of my good friends had a house directly behind it, so I was there all the time in the Old Orchard neighborhood of Webster Groves, Missouri. So here's our offices around the country, and our bankers are serving many of you from those offices stretching coast to coast. So when you hear our perspective today, we draw that from our team members from around the country. What happens in Arizona versus Illinois versus North Carolina versus Ohio can be different, in particular in senior living and the state funding for all the other social programs going on within CHSM. Whoops. And there's our team members. And what we're proud of at Ziegler is the long-standing tenure of the vast majority of our team members. So I just rattled through all those states, and each of those organizations I was referencing are served by different team members on this page. And that team continues to grow. So within the capital markets area, not-for-profit senior living, and for that matter, charter school and higher ed, are very, very specialized, and we're very proud to be committed to this specialized area of not-for-profit senior living where we're the leader generally year in and year out, and you can only do that with that team. So it's not just about being the leader, it's about bringing services and solutions to all of you around the country. And there are the logos from the CHSM UCC sponsored communities, every one of which is in the room, except for I forgot to ask, I don't think Horizon House made it, correct? So those are some recent CHSM member financings around the country. Each of those has a wonderful story. Some are single site, some are multi-facility that me and Lisa will be talking about when we talk about these trends. Another major theme and effort of Ziegler is our research and education, which we always hear back from you all. You greatly appreciate. Lisa heads up that effort for us, and we actually support her with 2 additional folks that we'll show you in a minute. And a lot of the pieces that come out of that are the Ziegler Leading Age 200 as an example, and there's 6 or 7 CHSM members that are part of that. We just noted a few of them, as well as our weekly newsletter. If you don't get that, please let us know. It's very rich in information, as well as our conferences. So many of you do attend our conferences. So for those in senior living, as a reminder, the CFO workshop is in New Orleans in the last week of April. And we get about 200 folks to that. That's Leading Age and Ziegler. And that'll be the first time in 3 years that we're getting together. It's also in New Orleans. We tend to tie in a little music at night. And then guess what? Jazz Fest is that weekend also. If you're a Who fan, there's Saturday night at Jazz Fest. So make sure to come to the workshop. And then our annual conference is in West Virginia at the Greenbrier in the second week of September. And we'll probably be back to having 700 plus people for that. And it's not the size, it's the fact that we get all the providers out like you've done here into one group setting. So with that said, I'm sorry, I said I'd show the faces. These are our researchers, Kathy Owens and Lily, and we just added another woman in Nashville supporting this group, Megan Cunningham. And then we also have a Catholic specialist. We don't have a UCC specialist, but it gives you the idea of how we commit to spaces. There's so much similar activity going on among all the Catholic providers in the country, the hundreds and hundreds, that Susan McDonough, who used to be on the Leading Age board, actually is our Catholic specialist liaison to the orders, which tend to need a fair amount of guidance and hand-holding in these challenging times, in particular if they're sponsoring a single-site nursing home. So with that said, Lisa, we're going to turn it over to you for our diversity on the governance side section.
Thank you. I was realizing, good to see all of you. I think I met many of you the last 2 days, but I am Lisa McCracken, the Director of Senior Living Research with Ziegler. And one of the things that we didn't include is next Friday, we actually have our Women in Leadership event. I know a number of you in the room have attended in the past and will be a part of that this year. It is hosted for women in leadership positions in senior living, but quite frankly, all of the speakers and panelists are very applicable to any leader. So if any of you are interested in participating, it's a virtual event. It's a 2-hour event, and we actually have Lee Siri and Nicole Pretree that are going to be on the CEO panel for us as part of that. So we're excited to be hosting that. So I'm going to talk about we have it labeled diversity's role in strategic governance. So one of the things that Ziegler has the opportunity to do is work a lot with boards and governance and strategic planning and obviously moving forward. And as Dan mentioned a couple times, during challenging times, so there are clearly headwinds that are out there across healthcare, social services, many different sectors that all of you have ministries in. And there are themes that we often see that often can differentiate strong governance from those that have, I think, some opportunities to evolve as a board. And elements of diversity absolutely play into that. And we're going to tackle that from a number of different perspectives and share some information and data around that, encouraging us, obviously, to take a really strategic look at that. And then we're going to talk about some of those headwinds and how clearly setting yourself up as a strong board and thinking strategically is going to better position you for that. So defining what I will be going through, diverse board composition, going to talk about that. Diversity and experience and background, that's the perspective piece, obviously. Diversity in thinking certainly is in that perspective as well. Board diversity versus consumer diversity and your workforce diversity. There are pretty significant disconnects in many circles in the not-for-profit world, and we're going to talk about that a little bit as well. So hopefully some takeaways within each of these elements. So board composition. And, I would just encourage you to take a look around your board and say, what do we look like? Does everyone look the same? And I know all of you have been to many different board meetings. I think last year we did, just in senior living, 75 different just board strategy sessions and presentations. And more often than not, it's a pretty homogeneous group. And that can be across age, gender, race, ethnicity, lifestyle. And I'm curious to know how many of you have specific and I'm not going to say bylaws, but things that you track to encourage and look at the diversity within your board and from a composition standpoint. Anyone? Okay, so probably about a third of the room that is tracking this and paying attention to it. So these are clear things that I think that are going to position your organization just from I don't say basic composition standpoint to be stronger without a doubt. And one of the things that we wanted to comment on under this umbrella is bylaws. So there are times where we set ourselves up for failure in this regard because of what is required from a board composition standpoint. And I know this can be a little controversial sometimes, but the no term limits, on the diversity front, you tend to develop a little bit of the same old when there's no expiration of your commitment on the board. So not to deny the benefit of that historical perspective, and we all know those individuals, and some of you may be those individuals on the board that have that great history and are a significant resource at the board level. But at the same time, there's also those individuals where, it's been 23 years and it's the same person, and you may not get that diversity in thinking that a term limit type of structure would enable you to have. And again, not to be controversial, but calling things out, there are just pros and cons to weigh with all of this, that there are a number of boards that require certain sponsorship representation, whether that's clergy, many of the Masonic-sponsored organizations have that, military-affiliated communities and organizations are similar in that regard. Those are just things that you just need to really take a look at. Not saying it's all bad, but it's weighing the pros and cons from a board composition standpoint. So we can talk all about board diversity, but if we are tying our hands by what is in the bylaws, we're setting ourselves up to be limited in that regard. There's a number of different cartoons with this, but I thought, this is an interesting one, and it's the gentleman says, I think we have all the bases covered with our new diverse board. You've got a clown there, a dog, a baby, and a number of different age groups. I think there's a little alien guy on there. And, and it was a very interesting article, and the title was When Companies Misunderstand Board Diversification. So at the end of the day, while it's important to know, okay, what is the age representation, what's the gender representation, all of that, it does go deeper than that. So we're not going to do a deep dive into that, but we want to acknowledge it's not just about bodies and head counts and checking boxes. It needs to be much deeper than that. But wanted to include that there. So again, diversity in experience and background. So one of the interesting ways to do this is, and again, I'm sure a number of you do this, but is having a grid of skill sets that you would aspire to have within your organization, and have each board member sort of weigh themselves on that. Everything, and I've done this recently, with a board that I sit on. There was up to 15 different things, everything from fundraising to education to DE&I, all different types of elements, and you rated yourself a 1, a 2, or a 3. And this gives a really good idea of some of the diversity of the background and skill sets. So, and I would challenge you too to say, if you do have something like that, or even if you don't, how traditional are they? Legal, financial. I mean, we know the traditional skill sets, and those professions are wonderful and much needed. But what are some more out of the box and ones that could really help propel you, not just to where you are today, but where you need to go? So I think it's bringing in those individuals from a background experience standpoint that can be helpful. Is there a resident or consumer voice on the board? And I know this one can be controversial, and if you're in children, youth, and family, I recognize you can't have a bunch of 8-year-olds governing your organization, but age is just a number, age is just a number. But you get the point here. It's how are you capturing that perspective? And we do obviously a lot of work in senior living, and that can be a little controversial, and some of it depends on the individual that you get and clear expectations as to what your role is and isn't. But any of you with FQHCs in the room? Federally qualified health centers. So they generally are health centers in more at-need communities, low-income communities. It's a federal designation. 50% of their board must be, they call them consumers or clients. 50%, which is very challenging if you talk to a lot of those CEOs, but it gives them a very unique perspective. That may be overstating what's realistic in many of your ministries, but again, it's where's that diverse background coming into play? And then diversity in thinking. So this isn't always easy to know up front and to bring people at the table. A lot of this is how you, quite frankly, handle your meetings and your governance. I know we've been in some board meetings, you're probably part of boards, and maybe this has happened in your own organization where there's a difference of opinion thrown out there and it's crickets. Or it wasn't handled so well in the past, so nobody's wanting to speak up. So how do you structure your board meetings to have some of that? We're all familiar with the generative conversation and so forth, but where is some of that diversity in opinions and perspectives sought out, as opposed to, does anybody have any feedback or any questions and so forth? So a lot of it is do you encourage that diversity of opinions in how you run your board meetings? And I still think in many respects, we've come, I think, a good long way in terms of being a little more efficient with our board meetings, but sometimes we can still be checklist and all good intentions, but at the end you've got 15 minutes for a discussion, when often that's not enough to do a real great deep dive. So how do you solicit diverse viewpoints, and how has healthy discourse been handled in the past, if at all? So again, this is maybe less about people and more about the culture and how you run your board meetings. And your board chair can have a lot to do with setting the tone in this regard. I have in here consumer diversity with board diversity. This is a big one, particularly in senior living. And the stats that we have here is on the senior living front. So what you can see here is we break down, this is by race. So we don't have at our disposal other breakdowns, but by race, the resident race across senior living settings. So independent living, low-income seniors housing, assisted living, nursing homes. We don't have adult day and those others. You can see here that that generally speaking, the lowest proportion being the low-income seniors housing, we're a very heavily white populated organization, sector in general when it comes to seniors housing. Access with, adult day, home health, home care, can be a little broader in that regard. And you might say, okay, well, yeah, maybe our board does represent that. Our board is 90% white or male or whatever it may be, but yet how does that communicate and position itself when you say we want a more diverse resident base? And we know many boards that are struggling with this and saying we would like to serve a more diverse resident base, but yet there's next to no diversity at the board level. So it's that you can be much more successful with some of those initiatives when you've got that diversity at the board level and can help you, again, in that regard. So that's one that I would point out. And then the workforce diversity, without a doubt. And again, this can be another area of disconnect. So I give, again, some statistics here for senior living, care for older adults. So here's the profile of a residential care aide in our sector. And this is pretty similar when you're looking at home care, really a lot of the caregiving and support for older adults. 85% are women, 31% are Black or African American, 21% are immigrants, and roughly half have no formal education beyond high school. So again, where are we, what's the board's role in also representing the workforce, the consumer base, and all of that, and also attracting those individuals. So I think sometimes there's too much of a disconnect in many of our boards. Age, along the age continuum, there's a lot of talk about the millennials. Obviously, we're all looking to recruit them and bring them and grow them into our fields and our sectors and our missions. Well, it is a generation that is much, much more focused and see diversity in leadership as much more important than previous generations. So they also see these work environments as more motivating, stimulating, and they are much more likely to be attracted to a diverse organization than one that is not. And if you're wondering what the numbers look like, the workforce participation in 2022 is 56 million millennials, 53 million Gen Xers, 41 million boomers. So again, when we're looking at, and we're all talking about these workforce challenges and pressures, the diversity makes sense at many different levels, but for the workforce recruitment standpoint, you're better positioned for that future and even current generation. By 2025, which used to think of 2025, that seems so far away. It's not. It's like less than 3 years, which is a little crazy. It will represent 75% of the global workforce. And all of this is really about change. We do a much better job of talking about change. Talking the talk's a lot easier than walking the walk. And, it definitely requires you to change maybe policies. I know bylaw changes are not easy, particularly the term limit one. A number of organizations go through that, and that can be really painful, and without it being personal to certain individuals that have been on there for 30 years. Again, board tenure, board bylaws, the ongoing just board education. And, for those of you who are leaders of your organizations, there are wonderful board members out there, but sometimes they just don't know what they don't know and really need to look to you from a leadership standpoint. And one of the things that we know, and we feel it and are seeing it every day, is that the pace of change is just moving so quickly. And the only constant is change, and the rate of change is increasing. So, all of this plays into, just the concept of diversity at the governance level. So that's setting the stage. I'm gonna just talk about a couple trends here and then hand it off to Dan. So that more robust governance model, and there's a lot of other elements to it above and beyond the diversity, but are just gonna better position you to deal with the headwinds. There's a lot of opportunity and need out there, so there's not a shortage of need and demand for what you do. It's just, again, being in a position of strength to manage that. And there is diversity among your membership of that position of strength. So one of the things that we're here to share as well is, going along with your theme of moving forward together and stronger together and being better together. It's where can all of you work together to hold one another up without a doubt. And I applaud all of you for being here. It's some of the ones that aren't here right, that we know within our brethren that we need to take a look at. So headwinds, there are some challenges. We're not here to be Dan and Debbie Downer. It is, we're meant to just acknowledge that things are changing and moving quickly. So clearly the pandemic, financial issues, staffing is probably number one for everyone. Competition. So we are in this room because we are, all of you are not-for-profit, deeply rooted organizations with fantastic histories. But I gotta tell you, the private sector across the board is running circles around us and really creating business models. Certainly in senior living and long-term care, we're seeing that, but we're seeing that in other elements. A number of years ago, I was the board chair of a group that we had a mobile dental clinic. Then we ended up reassessing that, long story with that, but there was this emergence in the area of these for-profit that looked like they were these free dental clinics, but that were opening up and catering to the children and the families and so forth. And I will tell you, that's not necessarily an unhealthy thing, but when we think about our not-for-profit legacy, we really need to understand how our markets are being influenced by the competition, and a lot of that's coming from the private sector. Regulatory environment's not getting any easier. Inflation, we're all living that without a doubt. And who is your customer? We know workforce is number one. Is there anyone that would say they're not having a workforce issue? Don't be afraid. We respect diverse opinions. Yeah, Chisholm is great. Okay, rub it in, whatever. So it's a challenging environment out there. And, again, you have the opportunity. You cross a number of different sectors, and I think there's great opportunities to have some partnerships with all of you. But, when we say who's your customer, it is not just the older adult, the child, the family. It is your workforce. So your brand better attract that individual. You've got to be really smart about what you stand for and acknowledging that, hey, you can be a part of something great here from the workforce standpoint. And then just the opportunity and the need is growing. I included a bunch of stats here, everything from mental health statistics. Any of you in mental health services? Well, you're probably all indirectly in mental health, right? That's just part of the package, right? Mental health needs have skyrocketed without a doubt the past 2 years. Drug overdose deaths and caregiver ratios, older adult growth in terms of that population. So the need is there. We specifically pulled out this demographic here, and I'm going to make a couple comments here and then hand it off to Dan. But this is the older adult population. This is the 75 plus. I could probably spend an hour just talking about demographic trends, but it's despite the mortality figures and how many we lost among the older adult population in this country, the wave is still very much here and growing. It's a diverse group. It's a much more racially diverse group coming up than what we've had before, economically diverse. The needs and preferences and wants are very diverse. So there's going to be great need and demand. And there's a couple other things that are at play here. When we talk about workforce, this is 75 plus. But any of you that pay attention to the population statistics, first of all, what was the last 2 years? It was not the baby boom, it was the baby bust, right? Early on, everybody thought, we're going to have all these babies. We're going to be shut down for 2 weeks, and we're going to have all these babies. And no, we have actually grown at the slowest pace in the last decade as what we have since the 40s. We are not replenishing cohorts and generations like we used to. So when we think about even the workforce piece in the future, it's pretty dramatic. And so there's a lot of things at play here. But at the end of the day, we call this demand, opportunity, need. And we acknowledge with the boomers, the denial's greater than any previous generation. The joke is they're all going to wake up dead someday, right? No. There's going to be need. So whether they think they're going to have a need for services or not, absolutely. So whether it's in your home, whether it's in one of your housing communities, whether it's a retirement community, the demand and opportunities there. Final thing I will say is when I mention that private sector and for competition, they see this. Absolutely. And they're moving much, much quicker than some of our conservative not-for-profit mindset allows us to historically do sometimes. So, Dan, I'm going to hand it over to you to talk a little bit about the inventory, and this breaks down a little bit of the now within senior living, and which obviously looks very different than what it would have 20, 30, 40 years ago. Dan? And then I'll chime in a little bit with some other things.
Yeah, that was great, Lisa. And again, we're trying to give an overview that could apply to all your organizations, but we know senior living is a big piece. And so Lisa will have the mic on, and I'll have her chime in a bit here as we go along, because we're experiencing as Ziegler team all of these trends we're sharing with you here today. So we like to remind everyone on the senior living side, remember earlier we mentioned that CHHSM organizations are in market rate communities going from independent living down to skilled nursing. They're in HCBS, which is home and community-based services, as well as big players in affordable housing with RHF and United Church Homes leading the way out of those 318 affordable locations. But on that the top category, life plan communities, this is really important, and it's going to be similar to what we'll show on hospitals. There's essentially no new not-for-profit provider organizations being created. So when you look around the room and say, what year were we founded? It's going to go back 30, 40, 50, 80, 100 years as we went through today, because there isn't the same need to found senior living organizations, because multi-facility organizations are filling the need, and because the private sector has been filling in the market for the last 30 years. All of which is fine. It's not unlike hospital organizations, which has been shrinking into multi-facility systems, but it's just recognizing that is important as we think about major metro areas. We have Jay Berry to my left here from Chicago, which is 9 million metro, down to rural areas where you have a number of CHHSM communities. So we have to constantly say, what are the trends and challenges in a multi-facility or in a major metro down to rural? But no new not-for-profits being created. And that sometimes shocks people. So think about your town or your state and say, when was the last new not-for-profit? It hasn't been for 20 years. Then follow the light blue down. So the majority assisted living, majority freestanding, and majority independent living. Those are terms that the NIC uses. 98% of the new locations have been the private sector, which means for-profit in the last 30 years. And then the purple areas are the inventory of the service, the home and community-based service world, which is heavily for-profit now, but started out not-for-profit. So we like to remind everyone of the percentages. Great opportunity for quality not-for-profit providers, as we just said on the demographics, to stand out in their markets, faith-based sponsored, United Church of Christ sponsored, and grow with the population as best as you can. We know it's challenging, but what we can guarantee is that same demographic chart that Lisa showed, the private sector is responding to in a robust way, and coming out of the pandemic, they'll continue to do that on bricks and sticks and on services. So here's the breakdown of for-profit and not-for-profit as a reminder, and the Ziegler team members present this a fair amount. Just to note, when you look at the left on our senior living construction status, you see the for-profit on new locations, the greenish versus expansions. They continue to build new locations, and they tend to be 80, 100, 120, 160, maybe 200 units, but smaller footprints, typically in visible areas. And the not-for-profit side has been primarily expansions, with you all in the room have done a wonderful job. I think every one of you in the room, remember we showed the Capitol, either has done a recent expansion of your campus or is doing one now. So that's what not-for-profits are very good at, is getting a brand established and then building it out. But it's become much harder to do new locations because of the high cost of land acquisition, the pre-finance period, and the period of time to construct and fill up is riskier, or perceived to be riskier than it's ever been. It used to be easy, but again, now the private sector is competing with you. So same thing on the right-hand side on the fourth quarter there of 21, where you see the new properties versus not-for-profit. So we can guarantee you, coming out of the pandemic, the for-profit side has an immense amount of capital to continue building new properties. However, the not-for-profit brands really stand out. When we go market by market and you do your consumer research, especially in markets where there's a fair number of not-for-profits, people tend to know the not-for-profit brands, especially when they grow into larger multi-facility systems. And while the entry fee model can be challenging, it also stands out in the market. So of those 1,940 CCRCs or LPCs, about 79, but let's call it 80%, 75 to 80% are not-for-profit, and the majority of those are entry fee. The 400 or so that are for-profit are majority rental. So just some trends for you to think about. But now we go to the growth of the senior living sector that we're able to track through the leading age Ziegler 200 statistics that we update each year. It just reinforces what I just said, and that is not-for-profits in the 200 expanded in just in 1 year, actually 2 years, we combined 2 years. Over 58 of the 200 did at least one expansion, but some of the multis did multiple expansions within that 58, and then did 42 affiliations. So that's the good news, is systems are growing through affiliation and acquisition. United Church Homes is in the room, and they've done a number, and they've actually added their individual to head up their management group, for example. So they're a great example here within CHSM on acquisitions and affiliations. But then you see we only had 16 new locations in 2 years for the whole top 200. We really, for the not-for-profit side, need to see that more vibrant. I'm hoping people can come up with models to accomplish that, and many are that are now trying to figure out how to do smaller models geared to the middle market, working with local developers. Again, I'll use Ken at United Church Homes, who has been working with some developers in Ohio and Texas, for example, with a smaller footprint model. So that's been great. But 30 dispositions by the top 200. Now that's typically pruning the tree of dated assets, often which are functionally or financially obsolete nursing homes. That's okay to prune the tree. If we did the whole sector, which we're going to show in a minute, there's been a much greater number of turnover. So we're hoping, keep it up on the expansions, we're hoping new locations can pick up, and then you're just going to keep hearing about all the affiliation opportunities of smaller organizations reaching out to typically larger. Why is that? Because of the pressure points, and this would apply to virtually any not-for-profit organization, maybe ranked a little differently. So we know the hospital market consolidated over the last 30 years. One of the drivers of that would be ranked higher is technology demands. So in the healthcare world, the expense of medical records is dramatic, huge. And so when Advocate, and you just have to remind me, is Advocate in the room, Aurora? Yeah, there you are. So remember, as you know, in Metro Chicago, and now you're up in Milwaukee, the amount of scale you can get, and you and I have watched Chicago consolidate down to, let's call it 8 systems, roughly. But the expense on that EMR side is just monstrous, and that would be ranked higher for health systems. But for senior living and for health systems, we've moved ability to attract talent up to the top. It's going to be a massive issue. We believe scale will matter, and we believe your HR, human resource management personnel are going to elevate up into senior executive ranks, command more dollars, command bigger teams in order for our not-for-profits and every form of healthcare and senior living services to survive. I wasn't reading email while Lisa was presenting, but if I did, there was a headline that said, it just flashed on the screen. Guess what's hitting home health this week? Gas prices. So
Yes.
And they're having to deal with it immediately. So you have gas and labor. So how is the home health business going to grow without creative HR or human capital management approaches? And then we know complexity of healthcare. Now, what is facilitating senior living consolidation is leadership turnover. So you noted a lot of the folks that have been retiring. As we look at that around the country, there is a tendency after someone's built up a community or smaller system to say, now that I'm retiring in this environment, I think we might want to belong to somebody bigger. So a lot of the affiliation situations have been at the time of retirement, although we're going to say later, please don't wait too long. Don't hang on the 1 or 2 years if you're close to retirement. And if you're a suitor to somebody smaller, we need to do what the health systems have done. I'm going to point to my Advocate friend. The hospital world got very comfortable putting out compensation packages for the executive team of the affiliating organization. 6 months, 1 year, 18 months, 2 years to make it easier. That became the norm in the hospital business. So we have that list. If anyone needs it, we could spend hours on that. But here's the stats for the whole sector just since 2015 of the total number of ownership changes in not-for-profit senior living. If we went to 2010, it's over 1,000. So the number of transactions are the 458, the number of locations are the 664. It's a huge number. But similar to some of yours, Mike, that were smaller, that the average person doesn't know about, like you and I know about St. Paul's in Belleville, the rest of the country doesn't know. We just had a Catholic nursing home close in Northern California, for example, that only the folks in the Sacramento region really knew about. So that's happening around the country in smaller rural organizations or major metro when you're under pressure in major metro. If folks wait too long, if they don't wait too long, the other not-for-profit providers would like to step in and add you to their platform. So we track this very closely. We have these stats if anyone wants to see it, and they scan the country. But again, you'd be surprised, like we probably have 30 in New York and Connecticut and Massachusetts, and you wouldn't even know who they are, as an example. Now, back to the hospital world, using Advocate Aurora as a good example, the total number of health systems, individual hospitals have been declining, and of course we'd have the growth in health systems. Now, we're the cousins to health systems and are probably trailing that trend by 15 to 30 years. It's not 5 years for the reasons I mentioned earlier. But there are no new not-for-profit health systems being created. Again, think about it. When was the last new not-for-profit health system? It just doesn't happen. They were already formed. So what we have happening is the growth of healthcare being delivered by the existing systems. If you go to a new market like Phoenix, where Michelle lives, then you have all this new population and you get new construction by Banner or by the other health system, not new not-for-profits. So the growth is organic from the existing providers, and that's what's going to be happening in not-for-profit senior living when folks are able to get back to building new while they're consolidating in players from around the country. So one of the things Lisa has been digging into just to get the point across, and UCC is very ecumenical in nature to start with, but that our faith-based systems stand out in the market in a nice way. Not-for-profit provider organizations appreciate being part of a faith-based system, and consumers tend to appreciate that. So we have seen many of the not-for-profit systems, faith-based, join and participate with other faith-based. I'm going to let her comment in a second, but a perfect example, who's not here because Bill Homan just took over, is St. Andrews in St. Louis, which was started out as Episcopal Presbyterian, and then Mary Alice happens to be Catholic. She's from St. Louis. I know her well, and so they folded in a Catholic organization. They manage a Catholic organization, and then they also folded in Good Samaritan, who is UCC. So they cover 4 different faith-based groups. You want to add anything?
Yeah, no, I was just going to elaborate a little further on this. So in our work we do with a lot of the affiliations and partnerships and so forth, there are times when some of your criteria lists may be a little more limiting, than particularly if you're coming at it from a little bit of a position of what we say weakness. And while ideally it'd be great to, let's say within the same denomination and faith, you can see the stats up there. Most of the time it's not. And, so one of the things that we tell organizations, whether you're Lutheran or Presbyterian or Mennonite or United Church of Christ, don't discount those other interfaith opportunities, because they can be really, really successful, and alignment of core values is pretty common. So, but that's where sometimes some of the boards get tough. We've had 2 organizations where they were both Presbyterian, but one wasn't sort of Presbyterian enough. And that's a problem when you're down to, less than 20 days cash on hand. You can't be that particular. And again, these are very successful interfaith partnerships and relationships.
So we're going to run into some folks, and there's some Catholic systems, some Lutheran, and some others may say, we really are going to present ourselves as Lutheran only at every community or Catholic only at every community. But generally speaking, folks are moving towards the ecumenical side. And we have a lot of Lutheran clients, and this is not a Lutheran meeting. LSA is doing a good job in that regard, but you'd be surprised at how much they struggle getting together, because you've had the ELCA Missouri Synod division that's now a little more fractured than it used to be. So I really think UCC systems are in a great position to grow from an ecumenical perspective with other not-for-profits. Whoops. So you may have seen this in different ways. It's just a reminder as you're thinking about growing through partnerships or combinations of resources. Jay, you've been working on different themes in Chicago, for example, and other single sites have. How can we get together and share resources? It's a tricky area, and this is a visual that Rick Stiffney had put together a number of years. I'm sorry, not Rick Stiffney.
Yeah, he did.
It was Rick. Okay. That Scott Townsley. You know, everyone knows Scott and Rick are the same person. So I was about to say. But collaboration, alliances, management companies. We have this Paracel Technology Alliance that's principally Chicago and Wisconsin that seems to be working out nicely as a way to share resources. Everyone's trying to figure out how do we get scale. It gets tricky. Clearly, when organizations are commonly owned, it gets easier to make fast decisions. All I'd say to you is every time we find a good example, the beauty of leading age and the state associations and its members is we're able to share that if people are able to accomplish that. So we have examples of all the different shared services. If people want to get those ideas, as we mentioned, United Church Homes now has a management company. So they'll offer out management to organizations many times on a temporary basis. If somebody says we're not sure we want to affiliate, and this would apply to others beyond them, you could have them manage for a while and test drive the situation. So a lot of those themes are playing out around the country. And then as we noted, just a member substitution, which is a form of affiliation, can still leave your faith base intact versus a full asset transfer. So Lisa, let's walk through our key governance takeaways since you just presented on the governance takeaways. We already talked about don't wait too long as it relates to looking at your options. And we have a sponsorship transition team at Ziegler. Steve Johnson heads it up and we added a woman named Marie Carlson that many of you know in the business, and we've got some associates working under them, and their plates are full. And again, the common theme is folks will wait too long to call because they're not anticipating a great recession and they're not anticipating a pandemic. So if you're on the edge and those incidents hit, you get hit, but so do the affiliators. So all of a sudden the affiliators who you thought you could fall back on have enough on their plate where they can't take a troubled situation to their board, and then it's too late. So keep that in mind. Moving from a position of strength is always helpful if you think it might be in the cards to pursue some type of an affiliation. In Ohio, there's been a number recently, and two had to do with retiring executives. Sunset Manor joined Otterbein when they were A- rated, when the CEO was retiring, and then our client Wesley Communities just felt like the pandemic was going to overwhelm them, generally speaking. And she, Peg Carmody, had 3 communities. We had just done a financing a year earlier, but she decided to reach out to another Methodist system, they're Methodist, and join them early, simultaneous with her deciding to retire, as 2 good examples of people moving in time. Lisa, you want to add more from this page?
No, the final, or the third bullet there is there's no mission preservation if the end result is closure. So, the boards that wait too long, well, no, we don't want to do this, we don't want to do that. At the end of the day, it is a board responsibility to maintain that mission. And if you are going down a wrong path quickly, there's no pride lost in reaching out to others and having that conversation. And I tell you, we get those calls, often, and we say particularly this time of the year because, it's a 3 payroll month. That's unfortunate.
The phrase, and we're trying to talk about the growth of larger organizations and healthier, or how to make sure you're healthy, but a phrase we've been using and I've been using is, and I do believe this, that the boards have a fiduciary responsibility to do everything possible to preserve the not-for-profit status and delivery services in the community they're in. So because you've taken fundraising and usually thousands of volunteer hours, meaning there's a long legacy of support. So if you get to the point where you wait so long that the debtors step in or that you have to close the doors, it's been too long, and then you're, in theory, throwing out all that fundraising and volunteerism. People, that gets to be a tricky topic, but stop and think about that. especially in the smaller towns. Because some people were asking what happens in the smaller town. So many of our system providers only have so much bandwidth, so they say, well, I don't want to go into a town less than 25, 50, 100,000. We need it to have some market oomph to it. But they will go in if it's a healthy enough situation. If the not-for-profit goes away, it'll end up being for-profit. That's okay. Basically, the private sector is serving much of rural America right now, but if a not-for-profit existed, it would be nice to try and do everything to make sure it continues to survive. Okay, so I'm going to shift to just a couple technology comments, then we'll have a wrap-up page, and we're going to wrap up right on time, because for the senior living folks, Lisa and Tom touched on this yesterday. The good news is that technology is playing out, technology and innovation, to allow you to extend and serve more residents, whether it's providing tools for the enterprise like electronic medical records, or for direct interaction with residents like care coordination or remote monitoring or a smart home, or whether it's tools for your labor force such as handheld nurse scheduling or devices to get to access your wages earlier, which is earned wage access. All of these drivers are playing out in senior living, but we're just, again, the little cousins to healthcare. So healthcare is huge on this. The big HIMSS conference is coming up next week, which I'll be at with our team. My God, has anyone been to HIMSS in this room? It is monstrous. We're talking.
Do you want to tell people what HIMSS stands for?
Oh yeah, Health Information Management Society, essentially. But it literally gets 50,000 attendees. The booths of Microsoft and Philips are monstrous. The booths are as big as this room for these big players, down to all the innovative players. So just know that's always going to be happening in healthcare, and senior living and post-acute and home care will follow along, but an enormous amount of innovation. So in our Ziegler Linkage Fund, we have literally seen over 2,000 companies, and we've vetted 800. We've done educational webinars on 120 plus, and then invested in 29. A day does not go by that, because I'm part of the team, that we don't get at least one email. One came in today while I've been here from a tech company saying, can you please look at our company? And they always have an innovative idea, always. So they're starting out local, or maybe just in one city, or maybe they have 20 or 30 clients just in a bi-state area, and then we hear about them, and then we help scale them up by investing in them along with other venture capital firms. So that's just going to keep playing out. On the right-hand side, we have the labor-related ones, where ARENA is artificial intelligence for recruiting and retention. That tends to work for organizations of 100 million plus. On Shift serves over 7,000 nursing homes with handheld nurse scheduling and time and attendance and earned wage access. So we could go on, but we know, and the industry knows, and the private sector and entrepreneurs know, that there's a massive need for technology to extend labor in every way, shape, and form. So look for ideas to come out, and as soon as we find them and they're effective, we'll broadcast them, as we'll cast. So Lisa, we're back to seizing the growth opportunity to end things here. So we mentioned board education. So board alignment with leadership is imperative. We know that the pace of change in the sector is going to be rapid. One of the things we advise is make sure that you have alignment with your board. We've on risk tolerance. Some people are more comfortable taking on more risk, others are more cautious, but where we see people move the quickest is when there's alignment with board down through management. And then if you don't have a corporate structure in place that's flexible for any of your organizations, that's easy to do in this day and age. All the hospital systems have a flexible parent subsidiary structure. Most of the senior living folks do. So think about that if you haven't. And then we, again, with the demographics the way they are, we'd make the case to say, how can you at least maintain your fair share of the demographics as they grow? Otherwise, others will be growing around you and put you in a defensive position. And that's one goal to think about. It doesn't have to be with bricks and sticks, could be with services. And then think about partnering. As we've noted, there's so many ways to partner. The service area is the easier area to partner. We have partnerships in home health and hospice and PACE. Lee, Syria, you have how many partners in your PACE program? Was that a 0? Oh, my fault, because I mix you. Wellspring has a partner, though, down in North Carolina. And then in Michigan, all the PACE programs tend to be partners with the state agencies. So think about that as a way to leverage growth, especially on the not-for-profit side. Lisa, anything you'd like to add?
No, I don't think so. Again, all of you clearly have a very strong network with one another. It's very evident the strength in your membership, and I think where it makes sense to collaborate among one another. And again, it's who's here and who's not here, and acknowledging where you can potentially partner and support one another.
Mike said in his last conference with us, he was going to give us till 20 after, so we have 2 minutes for questions. No. I'm just kidding. Any questions for us while you have us? Otherwise, myself, Lisa, and Tom will be out in the hallways. We appreciate our relationship with CHSM. Good luck to everyone out there. Thank you.
Thank you.
Thanks, Dan. Thanks, Lisa. So, that snack break that Elise promised you this morning is now happening in the foyer over